I see COPD is number one patient population. Then we see a lot of lung cancers, and obviously Dr. Tishko, I'm sure he's seeing a lot of lung cancers and non-cancerous nodules that we follow up on. And then obstructive sleep apnea syndrome, asthma, and sarcoid. Those are the 5 or 6 most common things that we see quite often.
Okay.
Dr. Sitar is a medicine doctor, so he sees the medicine kinds of problems, like you said, like the emphysema, the COPD. I'm a surgeon.
You're a thoracic surgeon?
I'm a thoracic surgeon, so my emphasis is on the surgical end of things, which is very often lung cancer. There are other problems that can sometimes be confused with lung cancer. Mm-hmm. But when we talk about lung cancer, surgery really enters the picture, and those decisions need to be made, whether it's a cancer or not, and sometimes just to get an answer about what the problem is that we can see on the scans.
You have to
operate and find out what's happening.
And as a surgeon, if you're not cutting, you're not doing your job, yes.
We're not doing our job, and we also know that if you have lung cancer, your best chance to live as long as you can is to have the cancer out. So surgeons like that kind of information because we can tell a patient pretty directly, if this is a cancer and if we can remove it, that's your best chance to live as long as you can. Mm-hmm. That's a good conversation to have because people need to hear that. Very often people hear lung cancer and they think the worst. But caught early, operated on properly, the results really can be pretty remarkably good. Much better than many people realize. So a big part of what we do is education. Let people know that what they think about some of these problems may not be accurate. You know, the old wives' tales, I think, hurt us because people spend a lot of time being afraid of things they shouldn't be afraid of. Mm-hmm. One thing that I hear over and over again is this old wives' tale that if air hits a cancer, it spreads like wildfire. That is a very common misconception. People bring that up all the time. It's just flat out wrong. Mm-hmm. But when people mention that, I can see in their face, I can see the worry. They're concerned. They think that's a real thing. When we go over the information, I say, no, that's an old wives' tale. That's just absolutely wrong. We can very often see people relieved. They just visibly look relieved to know that there is hope out there. So education is a very big part of what we do. Sure. And I think the burden that people have with some of these bad ideas, and sometimes that's the best thing we can do is get them accurate information, let them start thinking about things properly.
And of course, the right mindset helps the patient as well.
Absolutely. I think you can put up with almost anything if you know what you're putting up with and you know how to think about it. It's not easy, it's not fun, but it's certainly easier to know what you're dealing with. So education is a huge part of what we do.
Mm-hmm. My grandmother had one lung removed back in the 60s and for cancer, and she survived for years after that. Is that still, you can remove up to one lung in a person?
We do whatever we have to do to take care of the disease. I've taken out 1 2/3 of a lung. So I have a patient who's living on 1/3 of a lung. That's an extraordinary thing. We don't often have to remove a whole lung. That is not the commonest thing anymore. Taking out a portion of a lung, a lobe of a lung, sort of the division of a lung where a cancer is the most common thing we do. But as people are older and sicker, people with bad emphysema, people who've got other major problems that they're living with, they may not tolerate a big operation like that. Mm-hmm. And we have the ability to do much smaller operations, sometimes with a small single incision and a telescope, things that we couldn't do 5 years ago. So patients are coming into the pool, people are coming into the operating room sicker than they've ever been, but we still have new tools and new techniques to use for them. Mm-hmm. So do we take out a lung? Occasionally. Not nearly as often as we used to, but if we have to, we do.
Yeah. It seemed pretty radical at the time when I was a youngster, but...
it's a big operation.
Yeah.
That's an operation that you think very carefully about before you do it.
Right. And of course, coming back to that, smoking was the cause for grandma's lung cancer. That's still the biggest threat out there?
It's still number one threat out there for lung diseases, including lung cancer. The bad thing that happened over the last several years is smoking became more common in women. It was not as common in women, and now lung cancer also becoming more common cause of death in women. There are some statistics out there that it may be surpassing other cancer-caused deaths in women as well.
Wow, and I thought the levels of smoking in society were coming down, but that's not true?
To some extent it's true, but I think in Pickaway County we still have a lot to do to get there, to get rid of smoking and stuff like that.
And you mentioned the smoking cessation. You have a program at Berger?
Yes, we do offer smoking cessation classes, and where we educate patients, and if they need medical treatment to help them quit, we offer that as well, if they're interested in that. Mm-hmm. And that can be done through Lung Center as well.
Sure, sure. Well, everybody's always concerned about paying for services. Insurance, I would assume, fits right into the Lung Center.
Yeah, it's like in all the other medical services. Yep. It's not any different as far as paying for the services is concerned.
Yeah. What else haven't we talked about today that we need to let the community know and understand?
You mentioned a little bit about statistics, and those are always kind of tricky to talk about because the numbers become pretty overwhelming. But some of those numbers really need to be talked about. And lung cancer is overwhelmingly the number one cancer killer in the country. Lung cancer kills more people than breast cancer and colon cancer and prostate cancer and brain cancer put together. So the sheer magnitude, the sheer number of patients with lung cancer is overwhelming. Every year, over 400,000 people a year in this country either get lung cancer or die from it. And those are huge numbers that dwarf anything else out there other than something like a skin cancer. But it's the kind of problem that really does not have the sex appeal. It doesn't have Hollywood movie stars making telethons about it. So the burden, I think, is extra hard on a patient because they just don't have the awareness that some of these other problems do have. The problem, though, is huge. It's clearly related to smoking. Even though smoking overall may be going down, remember we have about a 20-year lag period. It takes 20 years to develop a cancer. If you stop smoking, it takes 20 years to start seeing those statistics dropping off. Mm-hmm. Around the world, lung cancer is still the number one cancer killer. As of 2010, almost next year, cancer is going to be the number one cause of death, exceeding heart disease. So these are huge problems that are getting bigger.
That's a shame that you have this kind of job security, if you want to look at it that way. But yeah, it is a shame. That's right. Oh, I hate to hear that. Okay, well, we're about out of time here on CGTV5 Berger Beat. Certainly want to thank Dr. Sitar and Dr. Tishka that are in charge of the Lung Care Center at Berger Hospital. What about a phone number for folks out there to call? 420-8526. All right, that was just a test. You passed. Well, again, thank you too for coming in and sharing with the community.
Thanks for inviting us.
All right, thanks. And this is John on CGTV5, and we'll talk to you next month on Berger Beat.